Hello, my name is Marcus Chavez and I'm with IFARA TV. Today we will be cablecasting segments of the press conferences that were held during the 22nd CROI, which is the annual conference on retroviruses and opportunistic infections, which took place in Seattle, Washington this year. This segment will be presented by Denis Malvy, who is with the University of Bordeaux in France. Denis talks about the early results of the JICI trial in Guinea. The JICI trial is a clinical trial of favipiravir, which is the current drug being used to fight the ongoing Ebola epidemic in Africa.
Thank you, Dr. Hanna. Good evening, ladies and gentlemen. So here I will present you early data from the JICI trial. JICI means hope in the Western African Malinke language. So these results mainly are referring to slight hope in the future care of patients. Before I do so, though, I would like to emphasize one point. The JICI trial is still ongoing, so I will be discussing preliminary data, and the trends we have noted may change as the trial is still progressing. For this reason, it is not common to release early data from an ongoing trial. The JICI investigators decided to do so together with the Data Safety Monitoring Board because they found that this data shed new light on the understanding of Ebola disease and had potential immediate consequences both for research and patient care issues. The JICI study is a drug trial that tests an antiviral called favipiravir. Favipiravir is one of the promising anti-Ebola agents identified by the WHO for fast-tracking testing. The trial takes place in 4 Ebola treatment centers in Guinea, mainly in the Southern Highlands, the region where the epidemic began more than 1 year ago. Since mid-December 2014, all patients with Ebola virus infection who present to these centers, in addition to standard supportive care, were offered inclusion in this trial that provides a 10-day treatment with favipiravir. The trial addresses 2 main questions. First, is mortality in patients who receive favipiravir is lower than mortality during the 3-month period immediately preceding the trial? And second question, does Ebola viral load decrease rapidly in patients who receive favipiravir? Among the 81st participants in the JICI trial, we clearly found 2 distinct groups of patients with very different initial characteristics, different outcomes, and different expectations as regards to the potential efficacy of the drug. One group, composed of 42% of all participants included in the trial, had a strongly positive PCR test, as indicated by a low cycle threshold value below 20, reflecting a very high viral load of approximately 8 log copies, which mainly accounts for 100 million viral copies per milliliter of blood. These patients had advanced disease complications, in particular acute renal insufficiency. During the trial, 93% of these patients died. And in the 3 months preceding the trial, mortality among individuals presenting with a similar level of Ebola viremia was 85%. Thus, it is highly unlikely that favipiravir monotherapy will ultimately be proven to reduce mortality in this population. The other group of the trial participants, 58% of patients enrolled, had a cycle threshold value reflecting a high or moderate viral load. Among these patients, visual consequences of the disease were less frequent and mostly reversible. During the trial, 15 of patients in this group died. In the 3 months preceding the trial, mortality among individuals presenting with similar viremia was 30%. Comparison of the trial and pretrial data therefore suggests that favipiravir monotherapy may reduce mortality in this population. With this classification into 2 groups, we have a much better understanding of Ebola virus disease and can reassess the place of antiviral monotherapies in the therapeutic arsenal used against the disease. We know that monotherapy with favipiravir will not improve survival in the group with advanced disease, and we call for other interventions to be urgently tested in this group. We have the initial impression that a monotherapy with favipiravir could improve survival in the group with less advanced disease. And the continuation of the JICI trial will try to reinforce evidence and confirm that it is firmly the case. Thank you.